Just before I start, I know it's hard to see me, but I kind of wanted it to be grounded. So if you just kind of settle into your seats and then I'll start. So as a whole person mind-body clinician, we're enacting the reparative model of not just being considered attentively, but being deeply heard, understood and responded to. This is why whole person care and attending to story is so powerful. To help us arrive at this organic space, I'd first like to tell my story of my call and the gathering in the whakapiri. And then I'll take you on a short journey to feel what it's like for our educators, whaiora and healthcare students. My call. You know that place. It's the dead end or cul-de-sac you come to when you're working with a patient, suffering from loss, a recent serious diagnosis, an ongoing illness, an incomprehensible injury, any life-changing event. All therapy, rehabilitation and best practice has barely taken the edge off the pain and the anguish. It seems that your patient faces an insurmountable obstacle and you are facing it too. It is that dead end you come to when you might just want to send them to another therapist or specialist. Things aren't moving. There is no room to move. But somewhere in your gut, you wish you were able to fix this for them and with them. This is how I arrived at the MindBody Guest House, with hopes of alleviating the circle of suffering. I wanted to learn how to work in this stuck place, because after a long career in healthcare, you come here often, and you care enough to know there is another way, and you know that way is very complex. I discovered from my MindBody community that a non-dualist whole-person approach provides a way of remaining with the stuckness, resting in it rather than wrestling with it. Being able to remain here with generosity, compassion and wonder creates a space around this obstacle. It allows a new route to go exploring this pain. In fact, the stuck place is where I find myself more and more often. It has become far more comfortable here to linger, no longer avoiding the tender spot. Able to remain here with safe holding and deep trust that it's okay and it's going to be okay. If you stay long enough and tread carefully enough, new possibilities emerge. It was a risk to enter this space with my colleagues, me staring away. It required tremendous trust that the fears, concerns and need to protect one another would be allowed. It was an entirely new experience, not focusing on disease and modality, an experience of working outside a known paradigm. It was an invitation for the whaiora and students to be with the difficulty itself. Engaging with difficult, tender spots is challenging. It's an uncomfortable space. The conversation flow comes to an end and the immovable obstacle is moved to another specialist or even the psychologist. Having more than one healthcare professional in one space opens up possibility not to move this on to the next practitioner. The nurse is essentially, physically already here, and so is the psychotherapist and the physiotherapist. And so what do we do then with this obstacle facing us? I figured if we kept asking the same thing in the same place in the same way, there was just no room to move. It took courage on my part and for my colleagues, who I led trustingly into the jungle, at times unable to find a foothold. We would try to name it, calling it capturing the intangible, but now we know that the intangible is a thing. So what we did, we just changed the venue, as simple and as complicated as that. We invite our whaiora who are seeking wellness and living with a life-changing condition or event to a venue together with students to explore. 5 sessions together over 5 weeks, 20 hours preparation and reflection. No longer a power relationship, not based on knowledge, no discipline hats, not just a diagnosis, but welcoming a person with a unique story in an unscripted encounter. Just a room with some people in it, a living space. Creating a unique space for something different to happen, a clinical space, an educational space and a therapeutic space. This way of being in therapeutic relationship lends itself to hearing the real story, the unheard, the unvoiced and deeply personal experience finds a place. Time is spent looking at what we call this whole person encounter and the challenges in naming what we do. We explore models of healthcare, including biomedical models, dualist versus non-dualist practice, and the Te Whare Tapawhā model, and incorporate understanding one's own spirituality. We teach active listening skills and encourage the integrating of subjectivity as essential and intrinsic to the whaiora's experience. Students are asked to listen and to look at meaning together. They struggle with how to do this. They rebel against it, and usually they go backwards and forwards to their default way of being a nurse or a physio, where it feels much more comfortable. The whaiora are encouraged to bring everything to the table. They talk together with their students in an uncluttered way, and they listen. The venue becomes a relational space where possibility opens up and often hope visits too. We listen to the students' needs as they emerge through group reflection, and we find out what they're facing, whether it be expressing empathy, problems with roles and boundaries, ethical dilemmas, and we address this as it arises. It is a season of growth, so there are often hurdles along the way, especially for the students. They need safe holding and care as they discover their own vulnerability is intrinsically linked with the vulnerability of others. What surprises the students is that the whaiora have no problem being with healthcare students in this way. They don't see themselves as separate from their disease or even as their disease. For the whaiora, having the opportunity to integrate themselves and their illness in a legitimate environment is highly valued. They sense and speak about the courage that it takes. It gives people hope that the healthcare system can be different. And I quote a student, "The whaiora weren't expecting anything, or didn't seem to be, but actually what happened is they experienced a real turn towards living well. They just wanted to be with the problem they had faced or were facing. The fears that were holding them back altered. With one whaiora, they almost had the clouds open and saw capabilities like a brief moment of respite. Something you don't often see in rehab, although one as a clinician is desperate for just that." It does call for courage, and it can be frightening in its uncertainty. Emotions surface, and it has an organic nature where things happen in the moment, and the edges of pain are softened and avenues are opened up for healing. The problems are not taken away or solved, they just look different. It's what we all hope for in rehabilitation, for some movement towards a whole person recovery, whatever that looks like. Nothing is excluded and everything is brought to the table. The students see a person experiencing their illness. It becomes an integration of the whole, not a tagged on biopsychosocial badge. Students seem torn between wanting to change and fix and intervene in the life of their whaiora and the mounting realisation that the whaiora are just happy to explore, talking about the experience of their experience. The students say they learned how to be with, no longer doing to, but doing with. And I quote a student, "I have learnt that being is doing, and also being with is enough doing, and even allows the doing." And an educator quote, "I think the student had an experience of being with the objective biomedical story, but in a more connected way, allowing the subjective experience to mingle with it, rather than be separately housed in a different box. Maybe they were learning to make meaning together as in a story. I think not having to reach a conclusion created the space for this to be. For some it's a turning point, a slow turning point that keeps on moving, and for others it's a threshold leap across the ditch where there is no going back. It's an experience of an authentic encounter. It looks at the truth together, however painful or shameful. For me, it has taken a certain type of fortitude. It reminds me to be deeply and actively patient while trusting in the process of growth, as I hold the belief that it is not only best practice, but is actually safer, more satisfying and more effective in improving health. And I finish with a poem, The Healing Time. Finally, on my way to yes, I bump into all the places where I've said no to my life, all the untended wounds, the red and purple scars, those hieroglyphs of pain carved into my skin, my bones, those coded messages that send me down the wrong street again and again. Where I find them, the old wounds, the old misdirections, and I lift them one by one close to my heart, and I say, holy, holy.